Have you ever stopped to think that something as simple as cleaning your mouth can influence how long you will live? Each tooth, each gum, each corner of the mouth holds secrets that can affect not only your smile, but also the health of your heart, your brain, and your entire body. What many people consider a daily habit without importance can actually have deep and lasting consequences. Imagine for a moment that while we neglect our oral hygiene, millions of bacteria silently accumulate, advancing without us seeing them, damaging gums, deteriorating teeth, and increasing risks that go far beyond the mouth. Problems that could have been prevented with simple daily actions, and by knowing which areas need more attention. Today, you will discover how the health of your mouth is directly connected with your overall well-being. You will learn about the most critical areas we usually forget, and you will understand how small changes in your daily routine can make an enormous difference. Stories from patients, results from scientific research, and practical advice will help you see your mouth with new eyes. If you stay attentive during the next few minutes, you will learn how to protect your health in an effective and simple way, avoiding unnecessary risks, improving your quality of life, and extending your years of well-being. What you will learn today could change the way you care for your mouth forever. The mouth is not an isolated space. It is a doorway into the rest of the body. Every time we neglect oral hygiene, the bacteria present in the mouth can enter the bloodstream and affect vital organs such as the heart and the kidneys. For example, recent studies show that periodontal disease, a chronic inflammation of the gums, is linked with a higher risk of cardiovascular diseases. A study published in 2018 in the Journal of Periodontology found that older adults with inflamed gums had a 25% higher risk of experiencing heart problems compared to those who maintained proper oral hygiene. But it is not only the heart that is affected. Oral health also influences memory and the general state of the body. Chronic inflammation in the mouth can increase the risk of cognitive deterioration and type 2 diabetes, according to research carried out at Harvard University in 2019. This means that caring for teeth and gums is not only an aesthetic matter, it is a direct investment in our health and longevity. In addition, a healthy mouth makes proper digestion easier, since the first stage of processing food happens there. If the teeth are damaged or the gums are inflamed, it becomes more difficult to chew correctly, which can cause digestive problems and affect the absorption of essential nutrients. In summary, oral hygiene is not an isolated habit. It is a preventive tool that protects the heart, the brain, digestion, and overall well-being. Keeping a clean and healthy mouth is a small step in the daily routine, but with a huge impact on our long-term health. Before continuing, I would love to know something so we can connect with our community. From which city or country are you watching us? Write it in the comments. I love getting to know the people who truly care about their health, and this allows me to create more useful and relevant content for you and your region. Various studies have consistently demonstrated the relationship between oral hygiene and general health in older adults. For example, a study published in 2017 in the journal Community Dentistry and Oral Epidemiology followed more than 1,000 people over 60 years old for 5 years. The results showed that those who did not brush their teeth at least twice a day and did not use dental floss had a 30% higher probability of developing heart diseases and a 20% higher risk of hospitalization due to infections. Another interesting study, published in 2019 by the University of Tokyo, evaluated memory and cognitive function in older adults in relation to their oral health. The researchers found that people with severe periodontal disease showed greater cognitive deterioration compared to those who maintained healthy gums and teeth. This finding highlights that the mouth not only reflects physical health, but can also influence our mind and our quality of daily life. Even research about longevity shows striking results. A study from 2020 carried out in Sweden, which analyzed more than 2,500 older adults, concluded that those who maintained complete and regular oral hygiene lived, on average, 3 years longer than those who neglected it. This shows that habits as simple as brushing, using dental floss, and rinsing carefully can have a real and significant effect on lifespan. These investigations remind us that caring for the mouth is not a luxury, nor a superficial detail, but a key component of integral health. As we continue in this video, you will see how applying this knowledge in daily life can protect your health and prevent serious problems. Many people believe that it is enough to run the toothbrush over the front teeth to keep the mouth clean. But the truth is that there are areas that are often forgotten and that are essential for oral health. One of the most critical areas is the tongue. The surface of the tongue holds millions of bacteria that can cause bad breath and contribute to periodontal diseases if it is not cleaned regularly with a scraper or with the same toothbrush. Another important point is the gums, especially in the area of the molars. With age, the gums can recede, leaving the root of the teeth exposed. This increases the risk of cavities, infections, and tooth loss if this area is not cleaned carefully with gentle but complete movements. The back teeth, the ones we use for chewing, are also areas frequently forgotten. The inner part of the molars and premolars, as well as the surfaces between the teeth, accumulate plaque that is not easily visible, but that can cause inflammation, cavities, and periodontal diseases if dental floss or interdental brushes are not used. Finally, the areas around crowns, bridges, or dentures require special attention. These structures can trap food particles and bacteria, and if they are not cleaned correctly, they can become sources of infection. Together, these critical areas show that effective oral hygiene goes far beyond simple, superficial brushing. Knowing them and giving them daily attention is the key to preventing serious problems and maintaining a healthy mouth throughout the years. Neglecting oral hygiene not only affects the appearance of the mouth or the breath, the consequences can be much more serious and affect overall health. One of the most common conditions is periodontal disease, which appears with inflamed gums, bleeding when brushing, and persistent bad breath. If it is not treated, it can lead to tooth loss, making eating more difficult and affecting nutrition. But the effects go beyond the mouth. The bacteria that cause periodontal inflammation can enter the bloodstream and contribute to the development of heart diseases, as shown in a study published in 2018 in Circulation. Older adults with diseased gums presented a significantly higher risk of heart attacks and strokes. Diabetes is another important consequence. Chronic inflammation in the mouth can make blood sugar control more difficult, creating a vicious cycle in which diabetes worsens oral health, and poor oral health makes diabetes harder to control. There is also a connection with cognitive health. Research carried out at Boston University in 2019 showed that older adults with advanced periodontal disease were more likely to present cognitive deterioration and symptoms of dementia compared to those with optimal oral hygiene. Even daily quality of life is affected. Sensitive teeth, gum pain, or recurrent infections limit eating, cause constant discomfort, and reduce confidence when socializing. This is why maintaining proper oral hygiene is not just a personal care habit, but a direct investment in health, longevity, and overall well-being. To better understand the importance of oral hygiene, let us look at some examples of patients that reflect common situations in older adults. Linda, age 68, thought that brushing her teeth once a day was enough. Over time, she began to notice gum bleeding and persistent bad breath. A dental checkup revealed that she had advanced periodontal disease and several cavities in her back molars. After beginning a complete cleaning routine and receiving professional treatment, her gums improved and the discomfort disappeared, showing how small daily actions can reverse significant problems. On the other hand, Robert, age 72, had neglected the use of dental floss for decades. He developed chronic gum inflammation, and a medical exam discovered that his systemic inflammation levels were high, increasing the risk of heart problems. With education about interdental hygiene and a correct brushing plan, he managed to reduce his risk and improve his overall health. Karen, age 65, used dentures but did not clean them properly. This caused recurrent infections in the mouth, pain, and difficulty eating. After learning proper cleaning techniques and establishing a daily routine, her problems disappeared, and she regained comfort and confidence when eating and socializing. These examples show that oral health problems do not discriminate and can affect anyone. However, they also show that with knowledge and simple habits, it is possible to prevent serious complications and significantly improve quality of life. Every small change counts, and it is never too late to begin caring for the mouth effectively. Maintaining a healthy mouth does not require complicated tools, but it does require consistency and attention to every detail. The recommended daily routine begins with brushing. It is suggested to brush at least twice a day, in the morning and before sleeping, using a soft bristle brush and a fluoride toothpaste. The movement should be gentle, circular, and covering all surfaces, front, back, and the chewing area of each tooth. The next step is the use of dental floss or interdental brushes. These tools allow you to clean the spaces between the teeth where the brush cannot reach. It is important to slide the floss carefully, avoiding hurting the gums, and to make sure you clean from the base of the gum to the tip of the tooth. Even 5 minutes a day dedicated to interdental cleaning can prevent plaque accumulation and periodontal disease. We cannot forget the tongue. Every morning, before or after brushing, it is recommended to pass a scraper or the same toothbrush over the surface of the tongue to remove accumulated bacteria, which helps reduce bad breath and improves the general health of the mouth. To finish the routine, rinsing with an antiseptic mouthwash can help eliminate remaining bacteria and keep the gums healthy. Some mouthwashes also contain fluoride, strengthening the dental enamel. It is important to choose a product suitable for older adults, avoiding those with alcohol that can dry out the mouth. By following this basic routine every day, it is possible to keep the mouth clean, prevent diseases, and improve quality of life. The key is consistency, correct technique, and attention to all the critical areas we mentioned earlier. In addition to the basic daily routine, there are tools and techniques that make mouth care easier and more effective. Electric toothbrushes, for example, are ideal for older adults since their automatic movements allow deeper cleaning and require less effort than a manual brush. Studies from 2019 published in the Journal of Clinical Periodontology showed that those who use electric toothbrushes have less plaque and less gum inflammation than those who use manual brushes. Oral irrigators are another excellent option. These devices use a pressurized stream of water to remove food particles and plaque between the teeth and around implants or dentures. They are especially useful for people with reduced hand mobility or difficulty using dental floss correctly. Choosing the right toothpaste also makes a difference. A fluoride toothpaste is recommended since it strengthens the enamel and prevents cavities, and it should be gentle for sensitive gums. Avoiding very abrasive toothpastes protects the teeth and existing dental restorations. When using these tools, it is important to combine them with correct technique. Gentle movements and covering all surfaces, dedicating enough time to each critical area. It is not about spending more time, but about cleaning efficiently. With these techniques and tools, oral hygiene becomes more complete and effective, helping prevent serious problems and keeping the mouth healthy for many years. The key is knowing the options, adapting them to your needs, and applying them consistently. In addition to the daily cleaning routine, there are additional habits that strengthen oral health and protect it in a complete way. Nutrition plays a fundamental role, since eating crunchy fruits and vegetables helps naturally clean the teeth, while limiting sugars and ultra-processed foods reduces the formation of cavities and plaque. Dairy products, because of their calcium content, also help keep the teeth strong. Hydration is another key factor. Drinking enough water throughout the day not only keeps the mouth moist, but helps eliminate food particles and bacteria. Saliva acts as a natural cleaner and protects against infections, so it is important to support its production and avoid dry mouth. Regular visits to the dentist are essential. Even if the mouth seems to be in good condition, a checkup every 6 months allows early detection of problems and the application of preventive treatments before they become serious complications. This includes professional cleanings, gum examinations, and evaluation of dentures or implants. Avoiding harmful habits such as smoking or chewing tobacco is also fundamental. These behaviors increase the risk of oral cancer, gum disease, and tooth loss. Integrating these additional tips into the daily cleaning routine ensures complete protection of the mouth and contributes to the body's overall health. Each positive habit adds up and strengthens disease prevention, improving quality of life and longevity. Up to this point, we have seen very important information, and I want to make sure that the essential concepts are clear. First, oral hygiene is not only a matter of aesthetics, but a fundamental pillar of general health. Keeping the teeth and gums clean protects the heart, the brain, digestion, and helps prevent chronic diseases. Second, brushing superficially is not enough. It is essential to clean all the critical areas: the molars, the gums, the tongue, and the spaces between the teeth. These are the places where the most bacteria accumulate and where many problems begin if they are neglected. Third, a complete daily routine includes correct brushing the use of dental floss or interdental brushes, cleaning the tongue, and, if possible, an antiseptic rinse. In addition, using tools such as electric toothbrushes and oral irrigators can significantly improve results. Fourth, lifestyle habits complement cleaning. A balanced diet, proper hydration, avoiding tobacco, and visiting the dentist regularly strengthen oral and general health. Fifth, it is never too late to improve. Even small changes in the daily routine can reverse existing problems and prevent future complications. Every action you take to care for your mouth translates directly into more health and well-being. Remembering these key points every day is the most effective way to keep the mouth and the body healthy in the long term. Consistency and attention to detail make the difference between simply brushing your teeth and truly protecting your life. Now that we have reviewed all the information, I want you to take away a very clear message. Caring for the mouth is caring for life. Each brushing session, each use of dental floss, and each visit to the dentist are steps toward a longer, healthier, and fuller life. It is not only about avoiding pain or bad breath. It is about protecting your heart, your memory, and your overall well-being. Imagine how you would feel in a few years if you maintained these habits. Healthy gums, strong teeth, fresh breath, and the peace of mind of knowing that you are doing everything possible for your health. That feeling of security and well-being is possible, and it begins today with simple and consistent actions. Do not wait until you feel pain or notice visible problems. Prevention is powerful, and each small daily effort has a real impact. Even dedicating just a few minutes a day to caring for your mouth can make the difference between complications and a fuller, more active life. Remember that each day is an opportunity to improve your health, to feel better, and to enjoy your life with confidence. Taking control of your oral hygiene today is investing in yourself and in your future. Now that you know the importance of caring for your mouth and how to do it effectively, it is time to take action. Begin your complete cleaning routine today. Brush your teeth, use dental floss, clean your tongue, and consider using a mouth rinse. Each step counts and will make an immediate difference in your oral and general health. I also invite you to reflect on your own mouth. Which areas do you tend to neglect the most? The molars, the tongue, the spaces between the teeth? Share your experiences in the comments, since this will not only help others identify critical areas, but will also reinforce your personal commitment to your health. Remember, it is never too late to start taking care of yourself. With consistency and attention, you can protect your heart, your memory, and your overall well-being. Every action you take today is an investment in your future, so do not wait any longer. Begin your routine and keep your mouth healthy. Your life and your health will thank you.